Hi everyone, welcome back to another video on my YouTube channel. Hope you all are doing well. On June 30, 2022, CMS issued a fact sheet on rural emergency hospitals and critical access hospital conditions of participation or COP updates. So in today's video, I will go over the content of that fact sheet. Let's get started. Rural Emergency Hospitals or REHs are a new provider type established by the Consolidated Appropriations Act of 2021 to address the growing concern over closures of rural hospitals. The REH designation provides an opportunity for critical access hospitals or CAHs and certain rural hospitals to avoid potential closure and continue to provide essential services for the communities they serve. Conversion to an REH allows for the provision of emergency services, observation care, and additional medical and health outpatient services if elected by the REH that do not exceed an annual per patient average of 24 hours. This new provider type will promote equity in healthcare for those living in rural communities by facilitating access to needed services. The overall policy goal of this proposed rule is to establish conditions of participation or COPs to ensure the health and safety of patients who will receive REH services in the most efficient manner possible while taking into consideration the access and quality of care needs of an REH's patient population. CMS has proposed standards for REHs that closely align with the current critical access hospital conditions of participation, in most cases while taking into account the uniqueness of REHs and statutory requirements. In some instances, the proposed REH policies closely align to the current hospital and ambulatory surgical center standards, such as the policies for outpatient services requirements and life safety code, respectively. CMS is seeking input from the rural community on specific proposed REH standards, including the ability of an REH to provide low-risk childbirth-related labor and delivery services, and whether CMS should require that an REH also provide outpatient surgical services in the event that surgical labor and delivery intervention is necessary. CMS is also requesting comments regarding whether it is appropriate for an REH to allow a doctor of medicine or osteopathy, a physician assistant, a nurse practitioner, or a clinical nurse specialist with training or experience in emergency medicine to be on call and immediately available by telephone or radio contact and available on site within specified time frames. The release of this proposed rule is the first step in implementation of this new provider type. Upcoming rulemaking in the calendar year 2023 Outpatient Prospective Payment System Ambulatory Surgical Center proposed rule is anticipated to include discussion of policies regarding Medicare payment, quality reporting, and enrollment. The final rule for the REH conditions of participation is expected to be included in the calendar year 2023 Outpatient Prospective Payment System Ambulatory Surgical Center final rule anticipated this fall. Critical access hospitals. In this rule, CMS also proposes to update the conditions of participation for critical access hospitals by adding a definition of primary roads to the location and distance requirements, establishing a patient's rights conditions of participation, and allowing for unified and integrated systems for their infection control and prevention, an antibiotic stewardship program, medical staff and quality assessment, and performance improvement program if the critical access hospital is part of a health system containing more than one hospital or critical access hospital. This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.